retained placenta, what does that mean? So after your baby comes out, typically the placenta follows, and that could take up to about 30 minutes, but if the placenta does not vacate the uterus after 30 minutes, it is considered to be a retained placenta. And luckily, this is pretty rare. The International Journal of Women's Health, they have reported that a retained placenta only occurs in about 1 to 3% of deliveries, but it's not great. So if the entire placenta is retained or just a portion of it is retained, like most of it comes out, but some of it is left behind, it could cause hemorrhaging or excessive bleeding, infection, and it needs to be taken out if that happens. So, okay, there's 3 different types of retained placenta. So the most common type is placenta adherens, and that occurs when the contractions after you deliver the baby are too weak to push the placenta out, and it remains like loosely attached to the lining of the uterus. The next one is trapped placenta, and that means that the cervix begins to close before the placenta has been able to come out. And then the other one is placenta accreta, and this consists of the placenta adhering to the muscular wall of the uterus instead of the lining. And this is sometimes, a lot of times, diagnosed before you actually have the baby. And if it is diagnosed before you have the baby, usually a C-section is recommended so they can get in there and remove the placenta surgically. So the reason why, after you have a baby, your care provider is going to stay between your legs for a while to make sure that full placenta comes out. They're also going to be monitoring blood loss. And ideally, your full placenta comes out, and what they'll do is they will check the placenta to make sure all of the pieces are there, to make sure there's not a piece that is retained. And it is possible for them to miss that a portion was retained. And so in that experience, later on, you might have a fever, excessive bleeding, a lot of pain, kind of some stinky discharge. Those are all signs that you potentially have a retained placenta, or at least a piece of retained placenta. So that's one of the many reasons why you really want to be upfront with any symptoms you experience postpartum. But most care providers are pretty trained to be able to tell if the entire placenta came out. And again, with bleeding, that's kind of an indication of if the full placenta came out. If there's more bleeding than usual, they might suspect that part of the placenta was retained. All right, so if you're one of those super rare people that has a retained placenta, how do they get it out? So one of the first things they're going to try to do is make sure that you continue to have contractions. And one way that they do this, especially in hospitals, is they give you a shot of Pitocin, which is artificial oxytocin, usually in the thigh right after birth. A lot of times they give this to all women, even if they're still having contractions. That's something that they do. Breastfeeding is another way to stimulate the contractions and make sure that the placenta comes out. And actually going pee can help too, because sometimes a full bladder can impede the expulsion of the placenta. Okay, so if these methods don't work, they might have to move on to manual removal. And what this usually looks like is the care provider giving you some kind of anesthesia, and then sometimes like sticking their hand into the uterus and doing like a sweep, which means they essentially feel around for and pull out any retained placenta. It's not great, but it usually works. The surgeries used to remove a retained placenta include a DNC, hysteroscopy, or a laparoscopy. In super, super, super rare cases, a hysterectomy is needed, but again, that's incredibly rare. And then antibiotics are usually given after the treatment to help reduce the risk of infection. Okay, so what to do? There's not much to reduce your chances of having a retained placenta. I mean, again, it's pretty rare. But one thing you can do is avoid the prolonged use of Pitocin. So the article in the journal I mentioned earlier, in the International Journal of Women's Health, they found that prolonged use of Pitocin could increase the risk of a retained placenta. So essentially only use Pitocin if it's absolutely necessary, not because a care provider thinks it would be cool to speed things up. You only want to use it if it's like actually needed and there's a legitimate medical reason for starting Pitocin. You also want to really pay attention again to those postpartum symptoms. If again you have that excessive bleeding, stinky discharge, just pain, go ahead and let your care provider know and they'll check for retained placenta. And then it's also important to, as much as possible, have some tools to stay calm if you do have a retained placenta, because I know that that can feel a little bit scary. So if you are told that they think you have a retained placenta, immediately start taking really deep breaths to try to keep from spiraling into anxiety. You also want to make sure that you have somebody on hand, like your birth companion, to hold baby in case you do need pain medications. It can be a little bit hard to hold baby while you're going through that, so have somebody there to support you. But as the care providers are trying to help you decide what to do, as much as possible, kind of distract yourself by really continuing to bond with your baby and letting that focus on your baby help to prevent you from spiraling into that anxiety and fear. And keep reminding yourself that you are being cared for by trained professionals. They're going to keep you safe, even though it seems scary. They know what to do and you will be fine. And then the last one, if you need that manual removal, you need to go into surgery, just envision this like warm golden light filling your uterus, supporting healing, supporting the release of the placenta, washing away any discomfort. And again, above all, just knowing that you'll be okay. But I do know that that can be a scary circumstance, but I've known women that it's happened to, and they were absolutely fine. If you have any questions about retained placenta, let me know in the comments below.